We're going to have a discussion or a mention of contracts. The contracting process in long-term care is very important. We'll talk about what contracts are, why we need them, and how you must maintain contracts in your facility. So what is a contract? We're all familiar with contracts. We have them in our everyday lives. But a contract is a legally binding agreement between two or more parties to carry out or to fulfill a legal purpose. For the sake of you as the administrator, contracts must be maintained in a contract binder, and it should be housed in your office, in the administrator's office. You want to guard this contract book with your life, and you want to make sure it doesn't leave the area of administration. Contracts should be well maintained. They should be reviewed often, at least a couple of times a year. That's always a great project for someone in administration. It's a great project for an administrator in training because we want to make sure that contracts are not only that they're signed, but that their date is still valid, that they have not, the date is not, has not, the legal and binding agreement date has not passed, or that it has expired. If it has, you definitely want to make sure that we follow up and request new signatures and or a new contract. Contract binders will be reviewed by inspectors during your annual survey. So why contracts? The reason we have contracts in long-term care is because we have a wide variety of professionals who help provide care to our residents and patients. Those who we might outsource employees. We also have teams of contractors and other services that help maintain our grounds, our buildings, our equipment. So we have to have contracts in place for all those different types of services. One contract that comes to mind first is the admissions contract. That's one of the very first things that you'll have a new resident and or a patient family member. They'll sign off on their new contract once they are admitted into the facility. This agreement is a contract that spells out the services the facility will provide and also the cost of those services as well. Examples of contracts: there's the admission contract that I just mentioned. There are independent contracts. You'll have services that you'll need from different consultants, and those are usually done independently. Medical records contract, pharmacy contract, registered dietitian. So there'll be a wide variety of independent contracts as well. You might have a construction project that needs to take place for renovations or for additions to the building. You might have labor contracts for outsourcing of different departments, leases, loans. You might have purchasing contracts. And of course, we also have in long-term care, hospice and or palliative care services, different teams of caregivers who come into the facility to supplement the care that nursing and other departments are providing. So you'll have a wide variety of contracts to maintain in your role as the administrator. Other examples of contracts are heating and air conditioning, in addition to the maintenance of the building. You might have an elevator that needs to be serviced. You'll have a contract with your fire hydrants for servicing, for other major supplies, for building and grounds maintenance. You'll have contracts for outsourcing different departments. As I mentioned earlier, your employees might be outsourced by physical, occupational, and speech therapy teams and companies. You might also have outsourcing staff within the departments of housekeeping, laundry, and food service. You may have contract needs for for patient equipment and adaptive devices, as well as contracts for maintenance of building, equipment and major supplies, and also contracts for physician services. So as the contract process begins, it's usually the corporate attorney for the long-term care company that may design the contract. The other company or the service might also propose their contract, but once both parties review the contract, then it must be signed and dated after both parties agree on the language and the terms. Sometimes companies have to go back and forth with the contracts before it is approved and agreed upon by both parties. Revisions may be needed, and sometimes that can be a very lengthy process. But once both parties have signed off on the contract and it is dated, then the contract is then effective. There is a promise of a price or a benefit of service with contracts. There's something of value that is promised, whether it's care or consultation, equipment, service of that equipment, staffing, whatever the case might be. There is something that is promised, and once that promise for that service has been fulfilled, then payment can be made, and both parties then are happy with service and the delivery of that service. So for executing contracts, again, they must be signed. If a contract is not signed in the contract book, the service is null and void. Contracts signed by persons who are under the legal age, usually 18 or 21. If a contract is signed by someone who has a mental illness diagnosis, if they have an intellectual disability, dementia, or substance abuse, the contract more than likely is not enforceable. The facility administrator, the staff, or the corporation could possibly be sued for breach of contract for the admission agreement. I mentioned this as being one of the most significant agreements for residents and patients as they enter the facility for care. But breach may occur if a resident is harmed. We've talked about that a little bit in the resident care management class. But if a resident enters the facility and is seemingly healthy, and if they are harmed in any way, then breach of the contract has occurred and a lawsuit more than likely would follow. Family members can also be sued for breach of contract for non-payment of services. In addition, facilities can discharge a resident based on non-payment of services. You do have to give a 30-day notice, but that is possible to discharge a resident if payment is not being made. And that's very important, where the bookkeeper has to make sure collection efforts are in place and collection efforts are timely. You don't want a resident to get too far behind with their anticipated payment, and if so, then your bookkeeper would need to notify the administrator, that would be you, that this particular resident, their family, are not paying the bill, and if that's the case, they are in breach of your contract. Contract acceptance process. Want to make sure we have a meeting of the minds, that both parties agree. Right now, our school is working on contracts for upcoming spring and or summer AIT training. Tarrant County College has a standard contract that we use for our facility affiliations, and so we present those to the facility, a potential facility for training. Those are reviewed at the facility level and also at the corporate level. We hope if there are any adjustments to be made, We want both parties, both sides have to be in agreement with any language or any changes that need to be made. We want to make sure that the duration, usually whatever the terms are, usually for at least a period of 1 year, want to make sure that that duration is intact as the contract is being signed and that it's agreed upon. Contract acceptance, again, that duration is very important. The acceptance must comply with terms of the offer, and after the offeree has accepted the offer and after the contract has been signed and dated, the other party is unable to revoke the agreement. It's too late, and the contract is in full service. It's a service agreement.